My name is Josefina Villavicencio. We also have Edna Garfias, Nicole Salvaria, Tania Gonzalez Naranjo, Maria Trujillo, and Karina Rivera. And our intervention is Madre Sana, Una Familia Sana, and we are Group 10. In the United States, obesity affects almost 79% of Hispanics ages 20 to 65. Among Hispanics, Latina women account for 65.4% of elevated rates of overweight and obesity. Due to cultural and socioeconomic factors, as well as language barriers, Latinas have limited access to healthy foods, and many of them don't know about public health interventions that promote healthy lifestyles. The goals of our intervention are two. Number 1, increase knowledge of healthier food choices. Number 2, increase physical activity. And number 3, to ultimately reduce BMI in our participants. We plan to form coalitions with community health centers and the local YMCA to help carry out our intervention. If we can make physical activity and a healthy diet part of our population's daily routine, we will be able to reach our goals and objectives more efficiently while making this new style a part of their daily lives.
Measuring outcomes. We will use a pre- and post-questionnaire after every class held to assess the knowledge gained by the participants during the course of the intervention. The BMI of each participant will be recorded at the beginning of the intervention as well as at the end. Both will be compared to see if there are any positive changes.
Our research design will be quasi-experimental, meaning our participants will be screened but not randomly assigned to groups. We feel this is the best experimental design because our initial starting population will come from a targeted group. The duration of our program will extend to 1 year. The study will begin in August and end in August of the following year, with measurements taken during these 2 time points. Our study is set up in 2 phases. The first phase is formative and aims to understand the barriers and facilitators to physical activity and healthy eating among Latina mothers. The second phase will pilot test a physical activity and healthy eating intervention. Our study will collect measurements before and after the program. We will have pre- and post-measurement data to assess participants' knowledge, as well as weight measurements at baseline and follow-up to account for changes in BMI.
The conceptual model. We know that cultural norms play a part in our eating habits, and our goal is to alter Hispanic mothers' eating habits, for them to have the knowledge and tools to guide them to healthy eating. Since we know that our targeted population can have good and bad perceptions towards cooking, they must use self-efficacy to substitute traditional foods for healthy options. The aim of this project is to promote the importance of healthy eating habits and an active lifestyle among Hispanic mothers. The main outcomes we plan to measure are 1. To reduce BMI before and after the study to effectively evaluate the results of the study. 2. To increase physical activity and increase knowledge of nutrition.